Claude Johnson, what will you do to reduce the long and short-term costs of health care?
Thanks, Frank. Listen, I just turned 50 years old earlier this summer, and I got an AARP magazine, and I was kind of shocked because I hadn't really had an opportunity to think about that before. But now, you know, I do, and it's not just necessarily because of me, it's also because of my fellow citizens, especially the elderly. And I definitely would support Sustanet as well as the Small Business Healthcare Alliance. And, you know, part of it is that I like my lifestyle, I have a healthy lifestyle, I teach that to my children and to my family, but everyone doesn't have that kind of awareness. So in terms of the Witherell, again, I say we must keep that facility open. And if we had more influence in Hartford, which I aim to do by getting Greenwich off the sidelines and also by changing the impression that Hartford has of Greenwich, and I think we'll be able to do that. Yes, we have yachts and mansions here, and that's wonderful because we admire the success of the people who have that level of attainment, but we also have many, many more working families, and of those, many are struggling to make ends meet. And we also have several thousand residents who have incomes below the poverty line, the federal poverty line, and many of those are elderly on Medicaid. So 60% of the residents in the Witherell are on Medicaid. The average age is about 85. And it's a gem of the community, and I was in there just last week speaking with the directors and meeting and getting a tour. And we need to keep it open, and what I would do if I were elected is I would make sure that I was at the governor's desk when the next certificate of need was introduced. And we need that in order to keep the facility open so that we don't let our seniors be abandoned.
Very good. Fred Camillo, would you like to reply?
Sure. My opponent keeps bringing up Nathaniel Witherell. In 2003, we were offered $25 million. The building committee in Greenwich rejected it. It kind of disappeared. There was a debate over whether to privatize it, to sell it off, privatize it, or keep it as a department. I was off the RTM then, but I sent an email to RTM members advocating we keep it as a department. I remember Drew Marzullo, Selectman Marzullo, was nice enough to reply and agreed with me on that. I'm very familiar with Nathaniel Witherell. My grandmother passed away there. My dad, who passed away in February, spent a lot of his last years in and out of there. I was there a few weeks ago with my dog, going around to see the people. I'm coming back in next week. No one needs to tell me about how valuable Nathaniel Witherell is. I've lived it.
Very good. Claude Johnson?
The other thing in terms of health care is that in terms of awareness, there isn't a lot in terms of just common sense legislation that would help us to, in terms of community wellness, understand the long-term costs of health care. So for example, the adult onset of diabetes, although it's about 8% of the population that suffers from that illness, it's about 23% of the total healthcare budget. And the numbers of people who are getting that are increasing at an alarming rate, but also it's getting younger and younger. So at our home, we have just common sense things that we do. We have treat day where the kids can only eat sweets on Fridays. And then in the mornings, we make sure that the first thing they eat is fruit. But what I would recommend is also labeling in restaurants, because trans fat and sugar and calories and empty calories are among the most dangerous health risks that we have in terms of long-term, not only our health, but also the cost to the state.
Very well. Claude Johnson, will you commit to a budget that does not raise taxes on the residents of the 151st District?
Well, it's difficult to say because I'm not in the legislature yet, but I would say that we have to be very wise about any kind of tax increases, if at all, that we do. So I think that it's not possible to commit to one type of budget or another, but I would say this: we have to have more taxpayers. So that's really the way to go about addressing this budget issue. More taxpayers, not more taxes.
Very good. Fred Camillo?
Thanks, Frank. Well, I am in the legislature, and I can tell you that I will not vote for a tax increase. I committed to that 2 years ago. I stood by it, and going forward, the reason why I say that, and I know there's always a caution, never, as President Reagan used to say never. I've seen how we spend up there. I see the waste that we have up there. I see that we could save up to $400 million in delivering social services by letting the nonprofits do it. That's been rejected, although it's going to have to be looked at now. There's just an awful lot of things that I've seen up there, especially in appropriations, that would really make you blink a few times. So I know that we can make this government a lot leaner and prioritize. We balanced the budget in our proposals not by cutting everything to the bone. We went back to 2007 spending levels in 2009. That was it. We flat funded the municipalities, meaning they got the same amount of funding as the year before. We flat funded the libraries because, let's face it, when times are tough, library usage goes way up. And so we were really careful about that. We did it through consolidation, elimination. We have special rights commissions up there. Say, for example, the Commission on Children. We have about 200 agencies and departments who deal with children. Yet we have a paid staff and director there. We spend millions of dollars a year. I would like to see that voluntary like we do on the town levels. We just can't afford it. You can't pay for something, you can't always want things that you can't afford. And clearly we have to get, we have $50 to $80 billion in unfunded pension liabilities. We've grown the government and shrunk the private sector the last 34 to 36 years. The state of Connecticut is the biggest employer in the whole state by 2 to 1 over its nearest private competitor.
Right. Claude Johnson, would you like to reply?
Yeah, thank you. Mr. Camillo voted against the deficit reduction bill that would have taken $1.5 billion out of the budget. He also voted against Sustanet and the healthcare partnership for small businesses, and also against pooling, which would have helped reduce the healthcare burden by taking people who would otherwise use the emergency room as a primary source of medical care. That's a tremendous burden on doctors. It's a tremendous burden on hospital facilities and also on our budget. So I think that we have to look at imaginative ways of going about this. One thing that's just obvious, and even though I have a Carnegie Mellon and a Stanford University engineering degree, it doesn't take a rocket scientist to figure out that we could easily reduce our costs by looking at Medicaid reform, by looking at home care, but still by keeping facilities like Witherell open.
Very good. Fred Camillo, would you like to reply?
I too also have a couple of degrees, are not Carnegie Mellon or Stanford, but I have something else. It's called good old COSGOB, common sense. And clearly, voting for things like Sustanet when we can't afford it to cover 7% is irresponsible. And what about the people who are struggling to pay? And I came from a very blue-collar, working-class background. In fact, that's the reason why I get along with a lot of the Democrats up there. They see me as someone who grew up similar to them up there, and there's a lot of Republicans up there, and I think our image is just fine. But they see that, and it's my dad, God rest his soul, always told me, he grew up in Chickahominy, and my grandmother lived in Armstrong Court, and when they were young, they didn't have they couldn't get new shoes, they used to put newspapers in their shoes. You don't spend what you don't have, and that's why people are so angry right now with government.
Very well. This question kind of found its way into our conversation earlier, so let's take it up and dedicate ourselves to it. Fred Camillo, what will happen to the Nathaniel Witherell Center?
Well, we don't know. When this, as I explained the chronology before, was rejected in 2003, the $25 million. This past spring, they offered $16 million. We wanted $23 million. It was going back and forth, and then the governor, through OPM, said we're not issuing any more CONs. We'd been in contact with people on the board of Nathaniel Witherell. We'd gone to the heads of finance, appropriations, the governor's office, finance, and we worked as hard as we could on that. The money's just not there. David Ormsby, I have a letter here in my pocket, which I won't hold up, who's the head of a bipartisan board, wrote a letter, and he's a Democrat, wrote a letter chastising the Democratic Town Committee chairman for using our seniors as a political football, and that our state reps, to quote him, were there every step of the way. So I take offense to this, that we were sitting on the sidelines, because we weren't. And the people in Nathaniel Witherell, whom I know many of, not just because I'm running for office, because they know me for the last 20 years, have thanked me for the work up there.
Very good.